What is Gerstmann syndrome? Gerstmann syndrome is a cognitive impairment that results from damage to a specific area of the brain known as the left parietal lobe in the region of the angular gyrus. It may occur after a stroke or in association with damage to the parietal lobe. It is characterized by 4 primary symptoms: a writing disability, agraphia or dysgraphia, a lack of understanding of the rules for calculation or arithmetic, Acalculia or dyscalculia, an inability to distinguish right from left, an inability to identify fingers, finger agnosia. Many adults also experience aphasia, difficulty in expressing oneself when speaking, in understanding speech, or in reading and writing. A 65-year-old man is brought to the emergency department due to an acute change in mental status. The patient was having dinner with his family when he suddenly had difficulty using his fork and appeared confused. Other medical conditions include type 2 diabetes mellitus, hyperlipidemia, and hypertension. The patient is a high school calculus teacher and has a 40-pack year smoking history. Blood pressure is 180/98 and pulse is 98 and regular. On physical examination, the patient is well-oriented, answers questions appropriately, and has no motor, sensory, or visual deficits. He is unable to add simple numbers, such as 17 plus 9. He is also unable to recognize or distinguish his fingers. Which of the following brain areas is most likely affected in this patient? The correct answer is D, angular gyrus. This patient's particular pattern of deficits is suggestive of injury involving the angular gyrus of the left, dominant parietal lobe. Damage to this region classically results in Gerstmann syndrome, which is characterized by the following signs: agraphia, inability to write; Acalculia, inability to solve mathematical calculations; finger agnosia, inability to identify individual fingers on the hand; left-right disorientation. Although Gerstmann syndrome may occur as an isolated syndrome, lesions to the angular gyrus may also be associated with alexia, inability to read, and aphasia, impaired speech, also tasks that require multisensory integration. Choice A. This area just anterior to the central sulcus is the precentral gyrus, primary motor cortex. Lesions to this area would result in contralateral weakness according to the somatopic organization of the brain. Choice B. This area posterior to the central sulcus is the postcentral gyrus, parietal somatosensory cortex. A lesion here would cause sensation loss in the contralateral body. Choice C. This location in the caudal part of the inferior frontal gyrus of the dominant hemisphere is Broca area. A stroke in this area leads to an expressive aphasia. Although patients with expressive aphasia may have difficulty writing, speech would also be impacted, usually characterized by non-fluent speech. Choice E. A lesion to the visual cortex, located in the occipital lobe, can lead to cortical blindness or visual impairment. Educational objective. Because the parietal association cortex integrates multisensory information, damage can lead to difficulties in comprehension and problem-solving in the absence of motor or sensory deficits. Specific injury to the angular gyrus classically results in Gerstmann syndrome, agraphia, acalculia, finger agnosia, and left-right disorientation.